So vitamin K is a fat soluble vitamin that is a necessary for the activation of certain clotting factor. So, so vitamin K is converted into the reduced form, which is active form of the vitamin A by a apoxide reductase enzyme. So this apoxide reductase enzyme is a very important because this is a target for a very high yield drug, that is a warfarin. So warfarin inhibit apoxide reductase. So that is again a very high yield. Okay. So this reduced vitamin K is important for the carboxylation of clotting factor 2, 7, 9, 10, and CS, protein C and S. So after the carboxylation, these protein C and S are mature and these carboxylated factor are mature. So these carboxylated factor are ultimately convert the fibrinogen, which is a soluble form, into the insoluble form into fibrin, while the protein cs that are the anticoagulant. So what they will do, so in this picture you notice that this factor 9a convert factor 10 into the active factor 10. So so this factor 8a is act as a cofactor, right? So the protein c inhibit this factor 8a. If this factor 8a is inhibited, so conversion of factor 10 into the factor 10a is inhibited. So if this is inhibited, so factor 10a conversion, factor 10a that is important for the conversion of prothrombin, that is a clotting factor 2, into the factor 2a, activated factor 2a, right? So again, the antithrombin, that is a very important. Antithrombin is a target for heparin. So heparin is again a very high yield drug. So heparin inhibit factor 2A as well factor 10A, right? While some drug directly inhibit the factor 2A, that are thrombin inhibitor, that is a dabigatran, while some drug that directly inhibit the factor 10A are apexiban. So now I'm going to discuss about the vitamin K deficiency. So vitamin K deficiency is basically there a certain risk factor, that is an inadequate dietary intake, mean malnutrition. So malnutrition, disorder of fat malabsorption, that is a cystic fibrosis, disorder of intestinal inflammation, that is a celiac disease, celiac disease, and IBD. So decrease production by the bacterial flora, use of broad spectrum, use of broad spectrum antibiotic. So use of broad spectrum antibiotic lead to the decreased production of vitamin K by certain bacterias. Okay, so the clinical feature of the vitamin K deficiency are easy bruising, mucosal bleeding, gastrointestinal bleeding. So laboratory finding of the vitamin K deficiencies are again of super high yield. So in this case, the prothrombin time is increased. If the severely deficient vitamin K deficiency, then PTT will also raised. So infantile vitamin K deficient bleeding, that is a very high yield stuff. So pathophysiology of infantile vitamin K deficiency is a low vitamin K stores That may be due to the poor placental transfer, sterile gut, low content in a breast milk, and insufficient vitamin K used by immature liver. So why is immature liver? Because neonatal liver is immature. So all these gamma carboxylation take place in the liver. So that is a gamma carboxylation is take place in the liver. That is why very important. So the clinical feature of the vitamin K deficiencies, so classically present at 2 to 7 days of the life, easy bruising, umbilical, mucosal and gastrointestinal bleeding, intracranial hemorrhage. So that is the key thing to be noted at the classically present infantile vitamin K deficient bleeding 2 to 7 days of the life. Okay, so the prevention is simple: intramuscular vitamin K at birth.